Why in the world does rolling a ball help plantar fasciitis? Hey guys, if you don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and one of the most commonly prescribed interventions to manage the acute symptoms associated with plantar fasciitis is to roll a ball, usually a golf ball, but it could be a lacrosse ball or a tennis ball, underneath the arch back toward the heel of the foot. So plantar fasciitis is characterized by pain at the heel, usually the bottom underside of the foot. The heel bone is called the calcaneus. If you want to Google it, you can see what the plantar fascia looks like. But typically that connective tissue gets inflamed, it gets irritated, it gets sensitive or painful. And massaging it often feels good. It brings at least temporary relief. So if you don't have the finger dexterity or your fingers hurt with massage, most people will use a golf ball, a tennis ball. They'll place their foot on top of the ball and just kind of massage and roll around. Now, one of the things that I find happens with that is the ball tends to slide out of position. The ball might roll away on you. To me, it's just not a good feeling. I have experienced plantar fascia many times throughout my athletic career, and typically when it happens, I always feel better with a little soft tissue or cross fiber massage. I prefer to do it manually, but rather than a ball, if you're looking for an easy, simple way to massage the plantar fascia in the base of the heel at home, placing either a rolling pin, a can of soup, a can of pop out of the fridge, putting it on a carpeted floor, and then using your foot to roll back and forth over that smooth, rounded edge tends to work a lot better. You can angle the foot to the inside or to the outside, depending on where you feel more of that sensitivity. But the actual mechanical pressure of the massage will help to facilitate fluid exchange. So it's going to push kind of the waste products out. It's going to help support the lymphatic system, but it's also going to desensitize some of those sensitized nerve endings. The reason we feel what we feel is because of the information coming from that area. So while you can put ice, you can put heat, some people do well with a foot bath with magnesium salts in there, Epsom salt. A simple massage for 1 to 2 minutes, multiple times a day, will usually provide you with 10 to 15 minutes of temporary relief. It's non-pharmaceutical. There's no side effects that we know of. And with enough patience, and then of course a physical therapy program to try and address any physical dysfunction, you can usually resolve the symptoms within 4 to 6 weeks.